Hello, my name is Melissa McLaughlin, and this is my question and answer video for the Faye W. Whitney Nursing School application. Back in 2007, I was working at an emergency and critical care hospital with a doctor named Dr. Roger Gefeller. He had just opened this hospital. He had come over from another hospital in town, decided to open up a hospital on his own, and he was looking to become a level 1 trauma center. And in order to do that, there was a specific list of things he had to meet. One of those was having a VTS ECC, so a veterinary technician specialist in emergency and critical care. So he had asked the 5 registered technicians who would like to take on this task. And I volunteered, having no clue what I was volunteering for. But I was excited. This was something that I was definitely going to do. What it is applying to sit to take boards with the academy. Part of this application included going to specific CE at conferences and completing a skills list. On that skills list, there are 29 out of 38 skills that you have to complete. Everything from recognizing signs of shock and pain, recognizing normal and abnormal lung and heart sounds, respiratory failure, recognizing those kinds of things, but also all the way up to inducing and maintaining and monitoring anesthesia on critical patients and then recovering them as well. Caring for patients on dialysis and also setting up ventilators, doing chest taps, placing central lines, doing cystocentesis, urinary catheterization in cats and dogs, males and females, and also monitoring central venous pressure, arterial catheter placement and arterial sampling, interpret blood work, being able to interpret radiographs, those kinds of things, CPR as well. So in addition to those things, you had to compile over 100 case studies, and you had to write up 4 case reports, 6 to 8 pages long each, on a case from your case studies, and apply to the board to be able to take tests. I did this twice before I was accepted, and upon acceptance, I took the test and I did not pass the first time. So I went back at it. I had to reapply. I had to do all these things for a third time, and this time I studied harder. I spent an entire year studying, reading books, spending most of my nights at home up until midnight, poring through journals and reading as much as I could and learning all that I could about emergency and critical care. And in 2013, I did pass the test and became a VTS ECC. By that time, Dr. Gefeller had unfortunately passed away. He tragically died in a car accident, and that hospital was then sold. So I didn't even work there anymore. I had actually been out of that practice for almost 2 years when I got emergency and critical care certified. But it was something I started, so I wanted to finish it. And I think that's me in a nutshell. When I take on something, I want to finish it. I want to learn all I can about the subject, and I want to do it to the best of my ability. Having been in the medical field for so long already, my values have always aligned with the nursing values. So integrity, accountability, those things are something that it's just been ingrained in me since day one working in the medical field. It's also something that I tried to instill in my students, being able to say, I don't know, but also backing that up with, but I'll find out. That is something I always tried to teach my students, and I thought was very important. Also, accountability, being able to say that you made a mistake when you know that you did. Fessing up to something can save a life. If you know that you made a mistake, it's very important to be able to be humble enough to go and to say, I did this, and hopefully somebody can help me fix this now, whatever that may be. Compassion is something that I think all vet techs have, all nurses have. We get into this field, we get into nursing for a reason, because we love people and we want to help. So that's a value that I've always had. Altruism. I have always given back to my community in different ways. I've been a volunteer in different capacities since the age of 12. And I've always liked being able to help out and give back. To this day, it's something that I like to do. Also, competence. Having competence in what you do is very important. Learning all you can to be able to be the best that you can at what you do. I think I exemplify that in many different ways. Professionalism. I think that's something that's actually lacking a lot today in the younger generation. They may act professional in some circumstances, but I think it's more than that. It's looking the part. So uniforms, dressing nicely, taking care of yourself, making sure you look good, just the little things like having scrubs that aren't wrinkled. That was something that I always also tried to instill in my students, was look how you want to present yourself. If you want to look professional, or if you want to be professional, you have to look professional. So make sure you put forth that effort in order to look professional. All the other things, loyalty, good communication, all of those things are, I think you can see by the rest of my application, things that I exemplify as well. I think that diversity, especially when you live in a diverse community, like I grew up in California, is so important, especially when it comes to healthcare. So one of the barriers to healthcare can be that cultural difference. And I think having people of all different cultures working together is great for many reasons, but especially in the healthcare setting, because if you've got somebody of the same culture of a patient that comes in, it can really help get over whatever those barriers that they're having at the time may be, whether it be a language barrier, whether it be cultural customs, or how they feel about seeking healthcare. All of those things can help that patient, but also it can help the rest of us who aren't familiar understand and learn for the future, even if we can't be that person with the same culture. Now we know. I worked in a veterinary hospital where we had many different employees from different cultures, and I think one thing that stands out the most to me was a situation where a Hispanic man had come in with his dog that had, unfortunately, testicular cancer. It was an older dog, and trying to explain to him that his dog had to be neutered in order to cure this was difficult for him to understand. It was also something he did not want to do. In that culture, that's just not something you do. So coming from the doctor, he wasn't taking it very well, but we actually had a gentleman who was also Hispanic descent and spoke Spanish, and went in there to the room and was able to explain to him in a much more culturally appropriate way than any of us were able to do. And we were actually able to then do the surgery and save this dog's life and save him his best friend. So that was something that really stuck out to me. That was, wow, it really does help to have a very diverse community around you. Being a little bit older, I've been through this many times. There have been lots of decisions that I did not agree with necessarily, from bosses, teachers, parents. One that stands out to me is a new hire my boss had made, and being a small community, I'd heard that this particular employee had been a problem at previous places of employment. And my boss, being altruistic the way she is, was willing to give her a chance. And though I didn't agree with it, I went along with it, and I did my best to put my feelings aside and treated her with the same kindness and respect that I did all of my other employees. And in the end, the outcome was that it turned out she really was going to be a problem for us. And that was another disagreement that my boss and I had. I very much wanted to get rid of the problem. She had become such a problem in the workplace that my other employees did not want to work with her anymore. And at that point, I was afraid I was going to start losing my other employees. So I went to my boss and I said, we gave it our all. We did what we could for her. We gave her a chance. It's been over a year, and everybody has gone above and beyond to try and help her and try and teach her and try and get to the bottom of what her problems are, and to no avail. So I put my foot down and I said, it's time. We need to let her go before we start losing our actually good employees, because they're not wanting to come to work. They don't want to work with her anymore. So in the end, the outcome was that she was given an ultimatum. She was told either you change or you leave, and she decided to leave. So at that point, everything resolved itself. The situation that stands out to me the most was a young puppy, large puppy, but a puppy nonetheless, who had been run over by her family, but with their own vehicle, unfortunately. And they ran over her thoracic area with their vehicle, and she had suffered pulmonary contusions, and she had some liver damage, and it was just not a good situation. But they decided they wanted to try and save her. She needed to be on a ventilator in order to do that. And Dr. Feller had picked me to monitor her for the first day. And I was absolutely terrified. I had never watched a ventilator patient. I'd never even seen a patient on a ventilator at this point. But Dr. Feller said, you can do this. I have faith in you. You're smart. It's going to be fine. I'm going to be right there with you. You can do it. And I said, okay. And I sat there with that patient for 16 hours on her first day on the vent, and I monitored her entitled CO2 and her respirations, and I watched the little loop-de-loop on the ventilator and drew blood gases every 4 hours and monitored her temperature and kept her warm, and I did all the things with Dr. Feller patting me on the back the whole time and giving me that assurance that I needed. But I can tell you, my confidence at the beginning of that day was absolutely shattered, and I had no assurance from myself that I was going to be able to do this. But at the end of the day, at the end of my 16-hour day with that patient, she was still alive. She was doing as well as could be expected. When I turned her over to the night vet tech and the night doctor, I left feeling like I had done the best I could do, and Dr. Feller was right there with me telling me, you did great. Everything you did was perfect, and see, I told you you could do it. So sometimes it's very scary to take on things like that, but if you have the right team in your corner, you can do just about anything. And I learned that day. I'd like to thank you for taking the time to watch this and listen to my ramblings. I sincerely hope that you will pick me as one of the nursing students in the next class. And again, thank you very much.